Hello all, I am Dr. Manoj Ayyappath. I am a specialist in gastrointestinal surgery, that is the surgeon which operates on the abdomen. Welcome to my YouTube channel. Today, friends, I am going to discuss with you about a few points about umbilical hernia. What is umbilical hernia? How does it happen? What are the problems of it and what are treatment options? Umbilical hernia is, what is a hernia? Hernia is a protrusion of bowel or intestine or part of your intestine or fat through a hole. In umbilical hernia, the intestine or fat protrudes or comes out through the hole in the umbilicus. So how does it present? The patient will notice a swelling around the umbilicus. It is initially painless and it starts increasing in size. Sometimes later it may become painful also. So that is what umbilical hernia is. It comes out when you strain and when you do heavy exercise, it starts coming out. It reduces by itself. It goes inside your tummy once it lies down. So this is what umbilical hernia is. And how does an umbilical hernia happen in adults? So it can be associated with obesity. So if you're obese, fat person, you can have umbilical hernia, and multiple pregnancies. So pregnancy will stretch the umbilicus, you can have umbilical hernia. A patient with fatty liver or cirrhosis of the liver or cardiac illnesses or any repeated coughing in such people can develop umbilical hernia. So all these patients will have this swelling in the umbilicus. And what are the complications? Sometimes what happens is it becomes really painful, and it is due to that hole starts constricting or pressing over the intestine which comes out or the fat which comes out. Then it starts really painful. So that is the start of complications. If you have pain, then you have to immediately attend a surgeon. So what are the I've already told you the problems and what you should do. Once you have an umbilical hernia, you should meet a surgeon as soon as possible. So he will examine you, he will diagnose, and he will submit you to different investigations. For example, he will ask you to do some blood investigations. They will take blood and do the necessary tests and do an ultrasound to know whether it is umbilical hernia, what are the contents of umbilical hernia, is there any other problems inside the abdomen. So he will do the necessary tests. Then he will suggest you to undergo surgery, because in umbilical hernia the only way to treat is to do surgery. And what surgery he will do? He can do either two surgeries. One is an open surgery, other is a keyhole laparoscopic surgery. So in open surgery, he will push this, he will make a cut there, he push the intestines inside, he will close that hole and place a mesh or a net over the hole so that it will not come out. And the next is the keyhole surgery, in which he makes small holes inside in the tummy and goes inside. Under the camera guidance, he will keep a mesh or net inside the abdomen. So which is good? Definitely keyhole surgery is good because it is painless. The patient gets admitted in the morning, they can get discharged by evening. In a matter of 3 to 4 days, patient can go for work. So laparoscopic surgery is very good for umbilical hernia. And now, what is the latest laparoscopic surgery? The latest keyhole surgery is ETEP, total extraperitoneal repair, which is extended. That actually, previously in laparoscopy, he will keep a mesh inside the abdomen, but presently the mesh is placed in between the muscles. It is an absolutely painless surgery, and the patient can go back to work in 3 to 4 days. So in umbilical hernia, I must suggest ETEP surgeries, very good, painless, and we do regularly ETEP surgeries. So this is what an umbilical hernia is, its complications is. So once you get these, when you think that you have umbilical hernia, you have to immediately visit a surgeon nearby your place, and if he suggests, please undergo surgery. And again, I request you to watch the video, share the video with your friends, and press the bell button in which you can get the new videos, update of new videos as soon as possible. That is a subscriber button. So once again, I thank you. Thanks.